A fetal medicine practitioner can be a radiologist or he can be an obstetrician. Both of them bring different perspectives to this practice. And understanding their individual perspectives becomes very important if you want to grow as professionals. Today I have someone from the other side of fetal medicine, Dr. Bijoy Balakrishnan. I had an opportunity to ask him some very interesting questions. Let's have a look. Hi, so fetal medicine in India is practiced by radiologists and gynecologists, depending upon the structured training that they have undergone. And today I have a very renowned gynecologist, fetal medicine practitioner with me, who is so well known for his conceptual teaching and obviously for his great expertise to fetal medicine that he brings, Dr. Bijoy Balakrishnan. Welcome, sir.
Thank you.
Sir, so I have listened to you as a faculty in ScholarMD programs, and students are so very appreciative, of the conceptual way in which you teach. So there are certain things which I always wanted to talk to you about. One is that the students that come to ScholarMD, they are all radiologists who want to upgrade their practice to fetal medicine. You come from the other side of fetal medicine, which is obstetrician turned fetal medicine practitioner. So in your view, in your observation, what are the advantages that a gynecologist fetal medicine practitioner has over radiologists and vice versa? What are your thoughts on that?
I think you can approach knowledge in two ways. One is you know the facts. Then there is this thing of utilizing these facts. Now, each of these specialities are looking at the fetus, but they are looking at it from their own perspectives.
Right.
So I think fetal medicine should be somewhere in the middle, where you are both an obstetrician as well as a radiologist. So an obstetrician should learn to be a radiologist, and a radiologist should learn to be an obstetrician. I hope that makes sense.
Very true.
So when I am approaching a patient, I know what the mother wants. So basically I know what the obstetrician wants. But my skills in imaging might not be as good as that of a radiologist, because a radiologist does scanning as a routine thing. It's their bread and butter. They've been doing it for so many years. They're already well versed with what the fetus looks inside the uterus. But they don't know the other perspective. For example, you can take measurements and say that the baby is small, but they might not know when to deliver the baby. They know that the baby is small, but they don't know what is the clinical implication of that small baby. And for that, they need the obstetrician's perspective. I think it's a two-way street. I think once you become a fetal medicine specialist, you cease to be an obstetrician if you're already an obstetrician, and you cease to be a radiologist if you're already a radiologist. This is a different specialty. This is not radiology. This is not obstetrics. And once you imbibe that, then you become a fetal medicine specialist. And that's why I think in ScholarMD, the advantage that at least these students have is that they get an unabridged perspective from an obstetrician's point of view. And so when I talk about a particular topic, I'm giving them the perspective of the obstetrician, which probably they might not have seen. And that's why they're probably appreciating it more rather than anything else.
Very true. Now, sir, there is one thing that there are many radiologists who are confused, after they pass their MD or DMRD in radiology, whether they should take up fetal medicine as a specialty. Because one thing is that many of us are not trained in obstetric ultrasound so much during our residency. The exposure is not that much. So you really have to learn that science and art after you have passed out. At the same time, the learning curve may be very slow, to develop that kind of expertise. You come from the gynecology or the obstetrician side. How has been your experience, and what would be your advice to radiologists who want to take this up as a career?
I think it's like learning alphabets and words. Okay, you can learn alphabets at school. You can learn words at school. But how you link those words to make a beautiful prose is entirely your own.
True.
Entirely your own.
Correct.
Nobody can help you there. So I have seen people running behind degrees, running behind fellowships, thinking that additional fellowship or that additional degree is going to somehow miraculously change their practice. It is not going to change their practice. It's like you can just get a degree, but if you don't know how to apply it, it makes no sense. So my advice to anyone who wants to pursue fetal medicine is the same advice I probably gave myself, is to understand how to do the basics, and from those basics you build your own world, your
Very
own
good.
world of practice, and then you become an expert, and then you reach a point where you will be the final word, rather than trying the other thing to just go behind degrees and just extend your degree list at the end of your name, and at the end if it is of no clinical utility, I think it's a total waste of time.
Yeah, so true. You have hit upon a very important point here. And the point that you're making is that one should not run after just qualifications, or certificates, and rather you should develop competence. So many radiologists who interact with me who are interested in doing ScholarMD fetal medicine training program, when they ask me regarding a qualification in fetal medicine, my usual reply is that what we are here for is developing competence. So don't just run after certificates. Okay, you get a certificate, but that is not the end point. The end point, our end point, is to develop competence in you, the confidence in you, so that you can upgrade your practice from radiology to a fetal medicine practitioner. As a practical aspect, in your practice, have you had any limitation that you did not have a foreign degree in fetal medicine or a certificate in fetal medicine? Does it really hamper for you to grow as a practitioner?
I think probably it has worked in my advantage, because I have my own perspective and I understood the basics. Definitely, you need to know how to do things. But from that point onwards, it is your experience with day-to-day cases, how you manage them, what problems are there with the patient, what problems are there with the obstetricians, and then you work towards a solution that is tailor-made for your practice. So I think one advice that I can give all these people who are taking fellowships and all, to not just think about it as a stepping stone into better refined practice, but you should use it as a stepping stone to understand what is actually happening and to use that in clinical practice. And one advantage of ScholarMD that I feel is, of course, you can read all these things on textbooks and YouTube and all those things. Everything is readily available, but you are getting something else here, and that is the experience of years of doing ultrasound.
Very true.
Whether it's Khurana sir, whether it is Ramurthy sir or Praveen sir, they are bringing along with them experience. And experience can never be replaced. You can read a single line in a textbook, but if that is backed with solid experience, then there will be a lot of stories, a lot of anecdotes that they can tell you. And those stories are what's going to make you a better practitioner. And you're getting it for free.
Beautiful, beautiful. I think this is so relevant, because ultimately theoretical knowledge is available everywhere nowadays.
Everywhere.
It is available on Google. Now in the age of artificial intelligence, you put a query and you will get a whole lot of data for that.
Everything.
But what really you can't get is the experience that these people bring and the kind of nuance they bring to this practice.
I'll give you an example there. If you ask the AI or ChatGPT or whatever is there to describe the Sistine Chapel, they will describe the Sistine Chapel. They will tell you every nook and corner of the Vatican. But if you ask the same thing to be described by a person who's actually been in the Sistine Chapel, he's going to tell you things that AI cannot tell you.
Correct.
What the room feels like, what the temperature was, what was the smell of the place, what was the attitude or the atmosphere of the place. So AI can give you information, but it cannot give you the feel or the experience of the real thing. And that's why teaching from good teachers makes a lot of difference.
Very important point. So I think this is something that you should take away from this particular interaction that I'm having with sir. He's made a very important point. Do not run only after extending your qualifications. The point is that unless you develop competence that is good enough for you to sustain you as a top ranked professional, nothing else will work. Am I right, sir?
Yes, absolutely. And also use this experience that these people have.
Absolutely. So you have such fabulous people. Fortunately, they are prepared to share their experience, and this is not available always.
Unselfishly, wholeheartedly. They have given it to you on a platter.
Absolutely.
You just have to pick it up and go.
So that's your point there. He has made a wonderful point, and I think I'm so thankful for you. So bring in this wisdom to us. Thank you so much.
Thank you.